You break your leg. No hospital. No cast. No painkillers waiting in a cabinet. Just you, the wound, and whatever your body and your tribe can figure out together. For most of human history, this wasn't a nightmare scenario. This was simply what getting hurt meant. No antibiotics. No X-rays. No sterile gloves. And yet your ancestors didn't just survive injury and illness. Many of them recovered from things that would send a modern person straight to an emergency room. How? The answer isn't luck. It's knowledge. Deep, tested, generational knowledge, passed down the same way you'd pass down a recipe or a story. Let's start with pain, because pain was constant. Every hunt risked a broken bone. Every winter risked frostbite. Every birth risked infection. Ancient humans needed something, anything, to dull the damage. They found it growing in the ground. In 2012, a researcher named Karen Hardy examined the fossilized dental plaque of Neanderthals from a site in Spain called El Sidrón. Dental plaque, in case that sounds strange, is just hardened bacteria and food debris that builds up on teeth over a lifetime. It fossilizes. It survives for tens of thousands of years. And buried inside it, Hardy found something remarkable. Traces of chamomile. Traces of yarrow. Both plants are bitter. Neither is particularly nutritious. Neanderthals weren't eating them for taste. They were eating them for what they do to the body, and both plants have documented pain-relieving and anti-inflammatory properties. So before writing existed, before agriculture existed, before anything you'd call medicine existed, your relatives were already self-medicating. Now here's where it gets stranger. Some of the willow trees your ancestors lived near contain a compound called salicin. Break it down in your body and it becomes something close to the active ingredient in modern aspirin. There's no definitive proof every ancient human society used willow bark for pain, but the plant was there, it was accessible, and the compound works. Later societies, from the ancient Egyptians to the Greeks, documented using it explicitly. Trial and error, repeated across thousands of generations, eventually looks a lot like science. But knowing which plant helps is only half the story. The other half is care. And this is where the evidence gets emotional. In the 1950s and 60s, a set of Neanderthal skeletons was excavated from Shanidar cave in northern Iraq. One skeleton, known as Shanidar I, belonged to a man who lived roughly 45,000 years ago. His skeleton tells a brutal story. A crushed eye socket, a withered, partially amputated arm, a limp, signs of profound hearing loss. By any reasonable measure, this man should not have survived to adulthood in the wild. He couldn't have hunted effectively. He may not have been able to see or hear danger coming. And yet the anthropologist Eric Trinkaus, who studied these remains extensively, found that Shanidar I lived for years, possibly decades, after his injuries. Someone fed him when he couldn't hunt. Someone protected him when he couldn't defend himself. His survival wasn't a medical miracle. It was a social one. This is the part modern people tend to miss. Ancient medicine wasn't only plants and wounds. It was community. A tribe that carries its injured, rather than abandoning them, is running its own kind of healthcare system. No hospital beds. No doctors. Just people who refuse to let each other die. So let's reconstruct what actually happened when someone got badly hurt. Picture a hunt gone wrong. A spear misses. A man's leg is torn open by a wounded animal fighting back. He's bleeding, in the middle of nowhere, hours from anywhere resembling shelter. The first move isn't panic, it's pressure and binding. Wound packing with plant fibers, animal hide, or clay like mud to stop the bleeding shows up across multiple prehistoric and early historic cultures. Some early humans appear to have used naturally astringent plants, ones that help constrict tissue and slow blood flow, packed directly into open wounds. Once the bleeding slows, he's carried back, not left, carried, across uneven ground, by people who could have simply moved faster without him. At camp, someone chews or crushes bitter plants like yarrow into a paste. It's pressed onto the wound. Whether the tribe understood the chemistry or not almost doesn't matter. What matters is that they had tested this pattern before, on other injuries, and it had worked often enough to become tradition. Now here's the twist that surprises most people. This system wasn't primitive. In some ways, it was safer than early modern medicine. For most of the 19th century, doctors in Europe and America didn't wash their hands between patients. Louis Pasteur's germ theory wasn't widely accepted until the late 1800s. Before that, doctors regularly spread infection from patient to patient with the very hands meant to heal them. Ancient humans, without knowing what germs were, often avoided this specific mistake simply because their care was less invasive, less centralized, and relied heavily on external, plant-based treatment rather than direct manipulation inside the body. In other words, for a huge stretch of history, going to an actual doctor could be more dangerous than not going at all. There's an even more extreme piece of evidence for ancient medical skill: trepanation. This is the practice of drilling or scraping a hole directly into a living person's skull, and it shows up in skeletal remains from thousands of years ago, on every inhabited continent. It sounds terrifying, but archaeologists studying these skulls have found something the skeptics didn't expect: bone regrowth around the edges of many of these holes. Regrowth only happens if the patient survived the procedure, sometimes for years afterward, which means ancient healers weren't guessing wildly. They had at least some working understanding of what a body could survive, what needed intervention, and how to keep a wound from killing the patient afterward. So what does all of this actually mean for you? It means the instinct to care for someone who's suffering, to feed them, protect them, sit with them, isn't a modern invention layered on top of biology. It's ancient. It's baked into why your species made it this far at all. Long before insurance cards and waiting rooms, survival depended on whether the people around you were willing to carry you home. Today you have antibiotics, anesthesia, and imaging machines that can see inside your body without cutting it open. But strip all of that away, and the two oldest tools in medicine are still sitting quietly underneath everything else you have: a plant that dulls the pain, and a person who refuses to leave you behind. You break your leg. This time, there's a hospital. But somewhere underneath the fluorescent lights and the paperwork, the same ancient instinct is still doing the actual work. Someone, somewhere, decided you were worth saving.